So I think we can all agree there are probably more questions than answers these days about how monkeypox spreads. We heard a lot at the beginning. Things died down. We assumed things were getting better, but they're not necessarily getting better. In fact, we're hearing of more and more cases. So how is the virus really spreading, and how is it spread stigmatizing the gay community? LEN TOOLEY is Director of Evaluation at the Community-Based Research Center, and he is on the line right now. Mr. TOOLEY, thanks for being here.
Hi there, glad to be there.
Can we go back a little to the beginning? And first of all, do I mention here? Am I correct in saying that you had monkeypox?
I did, yeah, back in June. I was one of the first 40 people or so in Toronto that got monkeypox.
How frightening was then that diagnosis? Because we knew nothing about it up until then.
Well, monkeypox has been around actually for a while globally, and I knew that it wasn't. Anything that would, be life-threatening. So I just sort of hunkered down and prepared myself for, the different range of symptoms, because it really can look very, very different from person to person, like how severe it gets. I was pretty lucky, and I didn't really have it as bad as some folks that I know who had much rougher times.
How did you feel about telling people that you had it, and how did people react to you, Len?
I've worked in sexual health for 20 years, so these kinds of conversations weren't new to me. I let any kind of sexual partners know they needed to. Turns out that actually one of my lovers did get monkeypox from me, and so we actually were sort of lucky enough to have each other to sort of go through the journey of monkeypox together, because it can be pretty isolating, and the recommended guidelines usually have people in isolation for 4 weeks.
Oh, boy.
So it's it can be quite a marathon. But I was lucky, because of my supportive social networks and family that it really wasn't too bad. And it was also pretty new at the time, so I don't think people really even knew that much about what to say or think.
So I wonder now, as I said, we thought after hearing it originally, things got worse, and then we weren't hearing about it as much, and we're thinking things got better. Is that in fact the case or not?
So when I got monkeypox just before Toronto Pride. There were about 40 or 50 cases at the time. Toronto Pride happened back in late June. And now, last numbers I heard, it was at least over 300. Oh. And a lot of, there's a lot of activity during Pride, a lot of people coming into town. And so, one thing that I think is important to recognize is that both Vancouver's and Montreal's prides were just in the, recent past. So I have a sense that there's a pretty good chance that we're still going to see numbers going up. And that, this isn't, just over. But as we're able to roll out more and more vaccines, then hopefully that, that should slow down at some point.
And we're talking about it more now. It seems to me like at the beginning there was a huge fear and there still is a stigma around it, so I don't want to make it sound like there isn't. But now at least we're talking about it. At the beginning, Len, they didn't even want us saying, that it was transmitted. It seemed to be transmitted primarily between men who have sex with men. It was kind of taboo to even say that. But isn't it important for all of that to be part of the conversation and for us to just be talking about it for awareness?
I do think so, yes. To me, stating facts about any communicable disease is not inherently stigmatizing, right? So we do know that, the vast majority of people who are getting monkeypox are gay and bisexual men. We know that most of the transmissions are happening sexually. I don't think that's a bad thing, because I like all of those things. I don't like monkeypox so much.
Fair enough.
To me, I think what's important to remember, and we can take lessons from COVID here, monkeypox is nobody's fault. Nobody deserves monkeypox. Nobody asked for it. Nobody wanted it. So, throwing blame around and spreading information that's ridiculous or unnecessary and unhelpful, those things are they're not very productive and don't really help anyone, I think.
Are you finding more and more of that now? I mean, I can imagine at the beginning when nobody sort of really had a handle on what this was, but is that still the case from what you're hearing and seeing from people?
Yeah, to be honest, I'm not on social media.
Well,
I left social media about 10 years ago.
That takes part of it away, yeah.
Yeah. But I have noticed just in the general media, right, there are different like levels of conversations about like, what's going on. Like, I sort of am resistant because I know what the facts are. Like again, this is nobody's fault. This is just, this is something that happens, just like COVID was something that happened. And so, so that's one piece. I think that like what I'm particularly not seeing in the conversation publicly and more broadly is really an expression of sort of solidarity and care, both for gay and bi men who and their communities who are navigating a really difficult time. Like it's a lot of people are scared and worried, but also and importantly, people who do get monkeypox. So while we do have, a stressed out healthcare system, when you have monkeypox, some people have complications. There's potential for secondary infections. There are things that they might want to see doctors about, and they know that if they're going to go to the hospital, say, that it's going to be a long ordeal, and they're probably going to not be treated so great, and have a difficult time. And so, just from hearing stories from a website that I wrote a website called IGotMpox.com. I've spoken to actually one young guy in Montreal who told me that I could share with his story. He had a rectal infection, and it was so painful that he had stopped eating when he contacted me. And so over the next 2 weeks, we were sort of checking in, and eventually got so bad that he did end up feeling like he had to go to the hospital. And that night he had to get emergency surgery. And it was just while there were some really nice healthcare providers, one doctor admonished him and said he should have known better than to get monkeypox. He should have protected himself, that he should be rethinking his life. Wow. So I think my concern, my sort of message is that, healthcare services, if that's what people are expecting, then they're not going to access them, which means that we don't know how many people have monkeypox, right, but also that people are, could be putting their health at serious risk just because they want to avoid the whole thing.
The shame element is just totally and completely unproductive. I think, if you want to have a productive conversation, let's talk about vaccinations, because I also feel like we're not talking enough about that. Where are we at with a vaccination campaign for monkeypox?
So this is an interesting topic. Since the very beginning, the federal government has sort of stated very clearly that the doses of vaccine that they had, they would not speak to how many there were because of national security reasons. I guess for fear that a terrorist might think that it was an opportunity to release smallpox. And so that's actually created a lot of challenges. I remember back just before I got monkeypox, they had just announced that they had released 2,000 doses of vaccine to Toronto. And this is we already knew that monkeypox was in Toronto and knew that it was going to be coming to Toronto as well, because it was already in Montreal. So the rollout has sort of followed the infections rather than been rolling out in advance of them. Mm-hmm. So it's hard to say what it's going to take for the government to actually release those reserves, state how many numbers there are, and try to actually get ahead of the problem rather than follow it along.
Well, I'm glad you're doing what you're doing, and that we're having these conversations, and just let's hope the situation
and the
improves.
Governments are paying attention, right, to some degree. It's not being ignored, thank goodness, at that level either. Len, thank you so much. Wish you all the best.
Thank you so much. Have a great day.
You bet. Len Tooley, Director of Evaluation at Community-Based Research Center in Toronto.